Hey, I'm Brian, and I'm going to take you through this Ultimate Frisbee recovery session. So I'm hoping you can use this right after playing, right after practice or tournaments. I also hope you can learn something. So I'm going to give you some nuggets that you can take with you for your training and recovery in the future. So let's start off seated. You can follow right along here. And I'm going to have you bring your right leg out around a 90-degree angle of the knee, kicked out to the side a little bit. We're going to keep our butt down, and we're going to rotate in and rotate out, just like that. As far as you can go, trying not to let your pelvis move, your torso, so your butt cheeks are planted on the ground, and you're just going in and out. So with everything we're doing today, the goal is to move without pain or without creating more discomfort than you already have. You might get a little muscular discomfort if you do this right after playing, right after a practice or a tournament. There could be a little crampiness going on, and that's okay, as long as it's not extreme. So we're going to get a couple more with this hip. I'm going to try to move us along nice and efficiently today. There we go. Now go ahead and switch up. Now I want you pushing into your end ranges. So the more you do it, the more you can practice pushing outward. We want to actively be using our muscles here. So a big part of recovery is not just rest, that is important, but how we rest. So joint movement and tissue movement is going to help stimulate blood flow, and it's going to help get nutrients in and out of our tissues and our joints. That's really important for recovery. Whew, we'll just get one or two more here. I'm fired up for this. Got a good workout yesterday, so I need this as well. So now what we're going to do is I'm going to have you lie down. We're going to do what's called ankle CARs, which is rotations, joint rotations. So pull your left leg up, hug it toward your chest, get a comfortable stretch. Then I want you to draw the biggest circle you can with your ankle. Okay, so nothing else is moving. Imagine or try to feel all those tissues around your lower leg working to pull that ankle in a big, smooth circle. All right, cool. Let's switch directions now. There we go. So any of these joint rotations, these CARs we're going to do, you can do as many as you would like to. Like I said, I'm going to try to keep it kind of efficient here today, but you could do 5, 10, 15 reps as long as it doesn't hurt. Really good for your joint health, really good for recovery. Let's switch up the legs. You can straighten that left, bring the right up, hug it into your chest, and nice big rotation. With any of the athletes I train, I have them do CARs like this every day, especially for the ankles, knees, hips, shoulders. So as you're doing this, just notice where you might feel tight or limited. Go ahead and switch directions there. Notice if that circle is more like a triangle or a square, or you can't move smoothly. You want to be able to plot as many points as you can on that circle with just your ankle moving. There we go. All right, you can relax there for a moment. Now I'm going to have you pull your knees up and straighten your legs, squeeze your quads, and pull back in. Squeeze your quads, squeeze your hamstrings to pull back in. We'll do a few of these. So with recovery, what I like to think about is what are the joints that were most affected and most impacted with the workout or with the game or tournament? And then also, what are your limitations and your biggest, challenging or problem areas? Those are the things you want to focus on. Today we're going to focus on a lot. So now I want you to pull the knees up nice and high, and now try to straighten. I don't expect you to be able to, but that's okay. Again, this is not necessarily going to be easy, okay? But it's going to drive blood flow in and out of the tissues and the joints. Whew, see I can shake a little bit. My left hammy's pretty tight from yesterday. So I'm just actively encouraging it to go where it can and try to push into that end range. Now we're going to relax there. Whew. And we're going to do some hip CARs, hip rotations from a quadruped position. So I'll walk you through these. And I have some other videos you can find that lead you specifically through different types of hip CARs. So you're going to pull your knee up, your right knee, up, pry it out away from your body. Rotate, reach the ankle and knee back behind you, way back towards that other leg and underneath. Then we're going to reverse, push back. Find the hamstring glute. Pry that knee and ankle out. Open up that hip without moving your belly button. Pull up toward your elbow and underneath. We're going to do 2 more like that. It might be a lot to think about or focus on at once. So just think about keeping your knee bent and draw a really big circle with that hip. And just imagine you're balancing something on your back. So you're keeping it nice and still. These don't have to be perfect, but we want to encourage big, full range of motion movements through our joints. Whew! Take a moment there, and then we're going to switch. All right, so we'll hit the other hip. Left one coming up. Out, rotate internally so that knee and ankle are going back. Then pull underneath. Drive back, find that glute. Pry open and pull. Whew! So recovery, even if it's right after the game, it can feel like a little bit of extra work. And if you're doing it right, it is. It is. It's going to be important to get yourself moving, even though the tendency is to want to just lie down or stop moving or relax, do nothing for the next several hours, which is very reasonable given the intensity and duration of most ultimate competition. But I'm going to try and encourage you to do a little bit more before you do that. So now, I'm going to have you go one knee, bring your left leg up, pry that leg out to the side. We're going to sink into this. Get a little groin stretch, maybe a little ankle stretch depending on your mobility. If you want a little extra, you can kick this leg out like that. Might not be comfortable. Internal rotation of that hip. I'm going to lean in and push into here for a nice big stretch. You can do whatever amount of stretch feels good to you. Then multitasking. Shoulder CARs with this right shoulder. So we're going to go across, reach up, rotate. Turn that palm and arm back, back, back. Go way back behind you toward your back side. Then reverse. Just like that. So just like the hips, nice big circle here from the shoulder. Boom. All right, a lot of ultimate athletes have shoulder issues and shoulder pain. I work a lot on specific shoulder exercises we can do in one of my programs. And so it's important to find your specific limitations, work within them, but also work to increase your capacity. So if you notice you have pain or discomfort or instability, you don't want to totally avoid it, but you want to work there within reason. Let's switch up sides here. Boom, out here. Find a stretch that works for you. All right, and then other shoulder. So for example, a lot of people get pain around this area. Okay, so I don't want you pushing into legitimate pain. Muscular discomfort or soreness is okay, but like real pain we don't want to push through. So what you can do is do these CARs in whatever range works for you. If this doesn't feel good, just go around that part and still push your outermost ranges in every other direction. And over time, assuming the injury is not severe, your body's going to start to extrapolate and allow you to work within that range with less pain and tension. So very important, you do these CARs regularly. Warm-ups, I love them as well as recovery. Whew, all right, cool. So now we're going to do a pigeon stretch. I'll show you. We're going to go here, step your right leg back, cross your left, and then you can slide back a little bit. Now this might look different for different people. The goal is we're stretching through here. Use your hands if you'd like to. And here's where it gets real fun. We're going to do an active pigeon. So you are going to lean in, use your leg to push you back up. You don't have to only use your leg. You can use your arms to help if you would like to, or if you need to. I want you to be stable here, and I don't want you to get any pain in your back or knee or hip. So actively driving up with as much force as we can, depending on your ability. And I have done this with a bunch of teams I've been a part of. In the moment, they do not like this stuff. Afterwards, they love it. All right. That night, the next day, I've had a lot of people of all ages saying they feel better because they did this. All right. Same side now. I want you to reach that right knee back, and now we're going to pull your heel toward your butt and extend. Pull your heel toward your butt, extend back. Awesome. So we're actively using that hamstring to close now. Okay, to close that angle of the knee. You can even push down into the floor if you want for a little extra fun. Awesome. All right, so all those joints that are getting a lot of use and tend to get beat up, we are making them work in many different directions. Let's switch up, all right? So I'll show you this side. Stretch your left leg back, cross your right, slide back a little bit, all right? Once you find a manageable spot, you can lean in, try to use that hip to drive you up. Use that hip to drive you up. I'm not so worried about exact positioning and angles here. Again, it's really about what tissues we want to affect. So glute, maybe hamstring. And as with all this stuff, as I do with my athletes, my clients, feel what works best for you and specific angles that work best for you. So maybe you get a better stretch here or here. Maybe you find a limitation that you want to work on. Feel free to experiment and play around with position. Left knee, stretch it back, and we're going to bend and extend. Another thing I tell all my people is as you switch sides, notice the difference. Observe. How does this knee feel compared to the other one? How does this hip feel? Active range of motion is very important and instructive. So what if you can only flex a certain amount and it's less than the other side? Something you probably want to work on, or at least be aware of. Whew, all right, we're gonna relax there. I guess I say whew a lot, don't I? It's that empathetic, like, whew, we're really working hard, right? So, now, love this one, active napping. All right, you're going to bridge up and we're gonna push one vertebrae down at a time. So, bridge up through your hips, lift up as much as you can. You can get an arch here, all right? Now, the topmost point of your spine that's not on the floor, I want you to try to push it down. Then the next one, then the next one, then the next. Rolling down nice and slow. Try to get that low back pressed down as well. Then your pelvis, relax, and we're gonna do it again. So bridge up, little by little. So each segment of your spine, we want to get individual movement. And to do that, we're trying to press little by little, each one into the floor till we get to that pelvis. Let's go one more time. All right, so just like our other joints, our spine needs to move to maintain its health. When your spine gets stiff, a lot of other things do not feel good. We tend not to move it as much, and then that just exacerbates the issue. And boom. Okay, another one we haven't worked on yet. Toes and feet. They take a massive beating. Just being in cleats is not good for our toes and feet. So I want you to try to spread out those toes. We're not going to do a bunch of toe lifts now, but work on that when you can. All right? Keeping this short and efficient. I'm going to have you keep your toes planted, rock into max ankle flexion, roll forward as much as you can, keeping your toes down and ball of foot down. Then we're going to rock back. Use these muscles to peel off. I'm throwing a lot at you here, but rock forward, drive that knee as much as you can down. It does not have to go all the way. Okay, this is something I work on a lot. You can't do it right now, that's totally cool. Peel, actively working this. Might burn a little bit, especially if you've been running around. Let's go one more. Rock forward. I'm keeping tension and weight here. I'm not just bending like that. I'm keeping tension on these tissues. That's important. Then I'm going to try to peel as soon as I can and lift. Awesome. So see how hard you can get yourself working on this. It's a fun game, right? All right, so boom, we're here. Rock forward. Roll that knee and peel. All right, so this is another good example of active versus passive range of motion. Okay, so you can rock forward. How far can you get? That's passive. And then we're going to try to actively contract, peel, try not to lose any of this angle, okay? Let's go one more. Rocking forward, back, peel. This is also a great prep exercise for before you play to make sure your feet, toes, ankles are all ready to go. And final one for today is we're going to do an adductor stretch. We're going to kick your right leg out, left knee down. All right, we're going to put our left arm down. It's planted. Arm stays straight. All right, get a bit of a stretch there. We're going to reach underneath with our left. Arm is straight. Then push through the left arm and reach up as much as you can. Reach under. So we're getting a little rotation through our body, through our torso and spine. And as you reach, you're going to find more of a stretch on that inner thigh, that adductor. Whew. Let's go for one more. And remember, you can do plenty more of any of these exercises if it feels good, if it feels productive. Awesome. Now we'll switch. All right. Right arm planted, left leg kicked out. We're going to reach, push through that right arm as we reach up with the left. I like to even think about spreading my arms as far apart as I can. So I'm pushing down and away through my right as I reach up and away with my left. Gives you a little more shoulder activation too. Pushing, reaching. This is our last one. Got it. All right, and you did it. So again, this is something that's really good for you to do immediately after playing, later in the day after playing, the next day. Even a lot of this stuff is great as warm-up and prep before. So any of the stuff we did today, you can throw in. If it felt like something you really want to be doing, you can do it daily. Ankle, hip, shoulder CARs especially are things that you're going to be doing all the time. I tell people if I did one exercise only, it would be hip CARs, okay, the hip rotations. And you can do those in other positions as well, okay? So thanks for joining. I appreciate it, and I hope you have a great day.